And so in terms of safety, one of the things I would say is that, we've gone through, as a country, as the NHS, we've gone through a series of checks. And the MHRA is our regulatory body. And they've not taken any shortcuts. And I think that's really key to point out, because one of the questions we get is, well, how on earth did we get a vaccine available and start the program within a year? And really, that's because this has been a global effort. And whereas normally vaccine production takes 6 to 10 years, it's because each stage is done in sequence. And so you will have one part of the process going on, then there'll be, request for funding and approvals and so on, and then the next stage, and then testing and phase 1, phase 2, phase 3. And the great thing is that globally, everyone has worked together in order to do these processes in parallel. And that's the reason we are where we are. And so that's the first thing I would say. There have been no shortcuts. It's just been really a result of everyone working together, understanding the challenge. In terms of protection, it's not as simple as getting COVID and recovering.
You've got 1 minute left.
A lot in terms of long COVID and the impact of that. The other thing that we're seeing is that from a protection perspective, if you go into the hospitals, so many of the patients in critical care are actually, of a BAME background. They look like you and me. And that's really worrying. So as we protect our older cohorts, actually we are seeing the younger ones get admitted. And so it's really important now that we have, if you like, a gold standard of protection, that we take part and we kind of utilize that option.